Aba, vloggers na rin yung mga bangtan ngayon, ha? Vloggers kayo, tay.
Good afternoon, everyone. Thank you for being here with us today. Welcome to the third World Cup Forum, DOH Meets Campus Press. Today, we will be tackling about the COVID-19 vaccination rollout game plan. Um, so just some webinar reminders. Keep your camera on, especially during picture taking. Turn off your microphone unless spoken to. Leave your questions in the chat box. And this webinar will be recorded and is currently live streamed on YouTube and Facebook. Please settle down and let's show our respect for the Philippine national anthem.
Mga kababayan, ang pambansang awit ng Pilipinas.
Kayang mag-ibig, dalas ng sinakalan, alam ng puso, sa titik mo'y bumay. Lupang hinirang, kuya ka ng magiting, sa manlulupin, di ka pasisigil, sa nagatak putok sa simoy at sa langit mo pagaw, ay hinatang tulad, awit sa pagkayang minamahal, ang isang ng matawad mo'y tagumpay na nagtitindig, ang bituin at araw niya kailan ang ay di magtitindig, luman ang araw ng walhagit pagsinta, buhay langit sa piling mo, ang inigaya ng pagkay mga api, ang mamatay ng dahil sa'yo.
Our ever-loving Father, the core of every reason, the source of truth. You who made the earth and the heavens are the ultimate goal of every knowledge seekers, the infinite wisdom, the cause of all that is good. We are truly grateful for this opportunity to gather together as a community despite the challenges we face each day. Yet you remained and gave us strength to carry on the responsibilities of bearing intelligence and using them for better purposes. We now humbly ask you to join us in our endeavor to explore the wonders of life in the world for knowledge's sake, that in whatever we learn today, we become more grounded to you, who is truth, who is love. We pray that you bless our speakers, the fount of your infinite knowledge, that they can share something worthwhile despite the limited time we have. They can channel all they know and share to us the beauty and truth of living as your child. We pray that you guide our participants, the seekers of your boundless knowledge, that they may continue to persevere in the search and be deemed worthy to share what they learn from today's session. Sanctify us, O Lord, not because we are worthy of it, but because we believe in your love and mercy, that at the end of the day, we can take home something that's amazing and meaningful. This we ask and pray through Christ our Lord. Amen.
Good afternoon again. We'll now proceed with one of the most important part of our program, and that's the introduction of our participants. So here with us today, in addition to our campus journalists, to our school publication advisors, we also have friends from LGUs and friends from NGO. Thank you for being here with us today. Mga taga-Lions, nandito din po. Good afternoon, everyone. We would also like to acknowledge Ma'am Yeyet, Ma'am Teresita Albert for being here with us today. And many more, no? There are Sir Lauro Feliciano. Thank you for being here with us.
Hello.
Hello. Good afternoon. To formally welcome us today, we would like to call on our executive director. Let me introduce him. He is a management practitioner, a journalism advocate, and a multi-awarded lecturer in Calabarzon, among others. He has been invited by DepEd multiple times as NSPC and RSPC judge. And prior to his stint in education, he was a former media practitioner, a stringer and desk rewrite man of the United Press International Manila Incorporated. Years ago, he was the regional coordinator of London-based SciDev.net. He is a member of Asia Media Information Center, or AMIC. He is also a member of the Philippine Chamber of Commerce and Industry and the Lions Club's International District 301E2. He has trained more than 400 learning institutions, including local governments and GOCCs. He is a workshop trainer in education, media literacy, and quality management systems across the Philippines and in Southeast Asia. He holds a doctorate in education and a master's in development management. He has also completed a master's in communication. His undergraduate degree is development communication journalism, and he has taken professional courses in teaching, which led to his license in professional teaching. Later, he has also hurdled the Environmental Planning License Board, which he believes is aligned to his advocacy in environmental quality management. He is also a career executive service exam passer, a certificated auditor recognized by the International Register of Certificated Auditors, or IRCA, and Exemplar Global. Ladies and gentlemen, please welcome Dr. Eugenio Ocalapi.
Thank you so much. Good afternoon. Hello. All right. We actually organize our workup for, or actually this is the third time, to provide our school administrators, school publication advisors, the campus journalists, a venue where they can touch base with the so-called movers and shakers of Philippine bureaucracy. Well, this forum with the DOH is very important to us. It's so important that I had to invite family and friends. In fact, I think my nanay, my inay from the province is actually listening, and so with my sisters. So this is really something very close to our hearts. So anyway, um, right now, we have to discuss something very, very important. It cannot wait a minute longer. It has something to do with well, our survival as a Filipino nation and even as a probably a race. Okay, so we know for a fact that the DOH has led a team that actually had to do with the planning the rollout for the available vaccines. So fortunately, I think as was stated in the news, there were around over 800,000 vaccines that were already deployed. But what we are interested right now is what about us, the ordinary folks? When should we get the vaccine? And when could we get it? So probably the team led by Undersecretary Vergaire, who will not be with us right now due to a family emergency. I think Dr. or Director Lorraine, Assistant Director Lorraine to this forum, can shed light on these matters. So thank you so much, Director, for being with us. So let us wait no further. Makinig, unawain, magtanong, at gamitin ang chat box upang mabigyan po natin ng linaw ang mga katanungan tungkol sa pag-vaccine. Okay, so thank you so much and welcome po sa Third World Cup Forum.
Thank you so much, Dr. Eugenio Calapi. Without no further ado, let me introduce to you our speaker for today. Dr. Beverly Lorraine Ho is the Concurrent Director for Health Promotion Bureau and Disease Prevention and Control Bureau Special Assistant to the Secretary of Health for Universal Health Coverage at the Department of Health, Philippines. Immediately prior, she was Chief of Research Division of the Health Policy Development and Planning Bureau, where she worked to provide the evidence needed to support health system reform by designing innovative research grants and building institutional capacity for policy research. These efforts have significantly contributed to the passage of key legislation on sugar-sweetened beverage tax, tobacco tax, and universal health care, and the institutionalization of the health technology assessment process. She has also worked in the Philippine Health Insurance Corporation and has provided technical assistance to the government of the Philippines and Southeast Asia on health financing, maternal and child health, and health impact assessment. She co-founded Alliance for Improving Health Outcomes, a nonprofit working to raise the profile of public health and develop a critical mass of public health professionals. Bev is a fellow of the Maurice Greenberg World Fellows Program at Yale University, the Equity Initiative, and the Atlantic Institute. She holds an MD from the University of the Philippines and an MPH in Health Policy and Management from Harvard T.H. Chan School of Public Health as a Fulbright Scholar. Ladies and gentlemen, please welcome Dr. Beverly Lorraine Ho.
Hello, good afternoon everyone. Maraming salamat po for this opportunity to allow the DOH to use your platform to get our message across to as many people as possible. Just allow me to share my slides briefly.
Dr. Beverly, please go ahead. You can share your slides now.
All right. Okay. Hello to everyone. I see a lot of young people also listening in to our call. Hi, and I hope you will learn a lot from today's session. And we look forward to you writing about this, no, to your both your classmates and to your parents and even grandparents as well. So first of all, just allow me to acknowledge several people who have contributed to the presentation. No, so it's a team effort, and I also declare no conflict of interest. All the brands that will be mentioned are part of the presentation, and in no way are we endorsing a specific brand of vaccine. Before I officially begin the presentation, which will run as 10 things, no, that you need to know para mas mabilis, no? So I'm answering basically 10 questions about the COVID-19 vaccination program. I just want you to look at these first two slides, no? So we will realize why certain people are in front, no, of the pila for the vaccines. So if you look at this, we put it in the graph, the age and sex distribution of COVID-19 cases and deaths. On the left-hand side, you will see the demographics of people who are having COVID. And on the right-hand side, you will see the demographics of the people who are dying from COVID. So the graph goes like this, no? So at the top are 0 to 4 years old, 5 to 9 years old, and the longer the bar graph, the more people are affected. So you will see that yung nasa taas na part, they are the younger ones, and in the lower part, they're the more senior or older ones. you will see on the left-hand side, the longer bars are in the top, no? Or actually top middle. So it means that the cases are actually for people 20 to 39 years old, relatively younger. And then for the deaths, you will see that the longer bars are on the right-hand side, meaning more people are dying from COVID, but they are elderly. No? So this is going to be one of the reasons later on why certain people will be further or first in the vaccination program, and why, say for example, little kids less than 16 or 18 years old are actually not included in the vaccination program. So next here, you will see the different types of COVID-19 infection. So when we talk about severity of infection, there are three different types. No, so if someone says I got COVID, it doesn't mean it's all the same thing, right? So there's COVID that's just cough, colds, and their chances of death is almost zero. There's moderate COVID where you need oxygen support, no? So you still need to be in the hospital. And there's a severe type of COVID, which is what we are all afraid of because we can actually die, no? This is the one where you can see from the photo, all of your healthcare workers are all wrapped up in PPE and you will just be alone in the room, diba? So this is the scary part of COVID. And when you look at all of these, it must be important for us to know that the reason why we are so afraid of COVID is because of severe COVID. If it were just mild COVID, it's just like the regular flu, right? Pero hindi no? Pwede mo siyang ikamatay. Pwede siyang ikamatay ng healthcare workers, kaya tayo takot na takot. No? And this is going to be later on, again, the reason why when we look at vaccine efficacy, you want to see what its effect, not just on mild COVID, but on severe COVID infection. Okay, first question that we need to ask ourselves, why do we need to get ourselves vaccinated? There are two main reasons. First, we want to protect ourselves. And second, we want to protect the people in the community who cannot get the vaccines. All right? So first, in terms of protecting ourselves, there are three main ways for which the vaccine can protect us. First, it will prevent mild, no, or symptomatic infection. Second, it will prevent severe infection. No? So, ibig sabihin, pwede ka pa rin magka-mild infection pero hindi ka na ma-ICU, di ba? And then the third is to prevent transmission. Hindi ko na siya mahahawa sa ibang tao. Then, for protecting the vulnerable, we know that we are targeting at least 70% of the population to be vaccinated so that some other people who might not be eligible for vaccination also gets to benefit from that protection. Diba? So, paano yun, no? So, overall, if some of you don't want to anymore understand how vaccines protect us, I will just leave you with this description, no? For example, we know in our community, merong umiikot to na hold-upper, di ba? So, hindi natin alam kung sino siya kasi hindi natin siya kilala. But when the barangay or the police will post something like a wanted sign, ito yung itsura nung magnanakaw, alam natin, di ba? So, when we meet that person, hindi na tayo makikipag-usap sa kanya or makikipag-transact, di ba? Correct? So, that's really what the vaccine does for us, no? The vaccine allows our body to recognize the bad virus earlier than when it actually arrives, no? In a way, you can also look at it as on the right-hand side, you see a baby. We are teaching the baby how to swim, right? Regularly, we know that when you put a baby on the water, the likelihood that he or she will be able to swim is actually very high, di ba? Alam natin yon because of instinct. But in some cases, the babies will not survive. So, mothers usually bring them to swimming school, etc. Di ba? That's really also, again, another point for how we describe vaccination. It's giving yourself a chance to practice, no, how to fight the virus. Okay? So that said, what we want to have is to have immunity. And the immunity we can get by going through a painful COVID situation or just getting vaccinated. So in both cases, you actually acquire immunity. Ang tanong na lang, do you want to acquire immunity through vaccination, or do you want to acquire immunity through COVID, di ba? Through having the actual real sickness, no? But in any case, both will actually lead to herd immunity if many of us get either one of them. So, just to make it very, very simple for all of us, what does getting vaccinated with COVID vaccine mean, no, for the outcomes that I have mentioned kanina? One, which is to prevent symptomatic infection or mild infection. Second, prevent severe infection. And third, prevent transmission. So, kita nyo, no? Here we describe, or Dr. Edsel Salvania describes the COVID virus as parang lion, no? Super tapang niya, 'di ba? Pwede kanyang kainin, kagatin, no? But with vaccination, this lion is like put in a cage, no? Yung tapang niya magiging not apparent, no? Because it's already in a cage. That is preventing symptomatic infection. Another way that the vaccine will act is to make the lion a kitten, no? Instead of kakagatin ka niya, magiging kalmot na lang siya, no? It means it becomes a regular cough and cold, no? And finally, the lion can also be put to rest, no? Or parang skull na lang siya, patay na siya because it cannot anymore transmit. So these are the three outcomes that we usually look for in the vaccine, no? Can the vaccine put the COVID in a cage, no? Can the vaccine make the lion or the really mabangis na COVID into a kitten? And finally, can it make the virus not anymore transmit? No? So ito yung tatlong outcomes. And usually, when it's being reported in the media, we only get the first number, no? Yung 94, 95%, that's only preventing symptomatic infection. You need to look at how much the vaccines are preventing severe infection. And now, most of the vaccines, they vary, no? Dun sa first bullet, dun sa preventing symptomatic infection. You get some 50%, 70%, 90%. But across the board, all of the vaccines now are performing more than 90% dun sa preventing severe infection. No? Kaya yun yung gusto kong maalala nyo. Kung ang issue talaga natin is ikamamatay natin yung COVID, actually any vaccine now in the market that has EUA actually has more than 90% or even close to 100% efficacy in preventing severe infection. And this is why many of the doctors are getting the vaccines, no? Whatever brand that is, kasi yun naman talaga yung labanan. Okay? So, here in this graph, I want to show you what herd immunity will mean for all of us. So in the boxes above, no, that is what we are now. So imagine yourself as a person that's color blue. No? So we are naive people, or ibig sabihin we're healthy, we haven't been infected with COVID. And when someone, color red, infected, comes around, we get infected. No? We also become color red. And after we get infected, we become orange, diba? As I've mentioned kanina, you get natural immunity. All right. But why do we want to get ourselves vaccinated? Because when you become a red person, an infected person, you always have the chance to be in an ICU, di ba? You always get the chance to be severe. Malasin ka, ikaw yun, no? So, gusto natin, wala yung chance na yon. So, magpapabakuna tayo. I'd rather sumakit yung arms ko kaysa naman ma-ICU ako, di ba? So, yun yung dahilan bakit tayo nagpapabakuna. And so, that's the pictures in the bottom. You see that when people have been vaccinated, they are already orange, no? They're considered recovered or immune. And so when this red person or infectious person comes along, hindi na siya kayang mahawa, no? Hindi na niya kayang mahawa yung mga tao kasi orange na sila. Okay? And more importantly, you will see in the bottom right box, meron pa ring mga blue, no? There are people in blue, meaning they couldn't even get the vaccine. Why? Because they probably have certain conditions, they're still babies, they're very fragile, basta bawal sila kumuha ng vaccine, we are protecting them. Kasi we are not going to be in any way red, no? We're always going to be orange, and orange people don't infect other people. Okay? So I hope this diagram should cement to you bakit natin to kailangan gawin. Hindi lang para sa sarili natin, but to protect the many individuals around us who cannot get the vaccine. Okay, that said, we proceed to question number 2. Many people are asking, which vaccines will we use? No, there are 7 vaccines in our entire portfolio, of which 3 have already permits, no, or EUA. Of them, all 7 of them are 2 doses. Kailangan, no, mag-inject twice, no, 2 times. Pero isa lang sa kanila yung 1 dose. That's the Janssen, no, Johnson and Johnson. Also, we need to remember that even if they're in our list, hindi siya bibilhin hanggang there's no permit. Okay? Then we have several expert groups made up of independent experts who actually are helping us out in assessing the safety and the efficacy of the vaccine. Do the vaccines really work? No? So I laid out here some of the questions that they try to answer for us. So iba-iba po sila ng expertise. No? So you might not need to go into the details. We'll just share the slides with the ano na lang po, no? The organizers, and they can share it with all of you. So the question now is, safe ba yung vaccines? The answer is yes, no? We are very clear about the safety profile of the vaccines, and we know that the benefits of using it outweigh the risk. Ano ba ibig sabihin nun? Very simple lang, no? So pag lumalabas tayo ng bahay natin, we know that there's always a chance, no? That either madapa tayo, masagasaan tayo, ma-hold up tayo, whatever, di ba? But we still do it. Why do we do it? Because the benefits of going out, to feel happy that you're going out to the grocery to get what you want, to go out to your job, to earn a living, the benefits outweigh the risk, di ba? It's always like that. Nothing is without risk. And so now the experts are helping us assess, okay, is it worth it to use the vaccines even if we haven't finished all the trials yet? No, so the answer is yes. No, based on their assessment, we will go through with it. So the vaccines have already undergone preclinical trials with animals, phase 1 clinical trials of 10 to 100 people, phase 2 trials of 100 to 1,000 people, and now phase 3 clinical trial. Usually, we finish the phase 3 trial of up to 30,000 people before they're given a CPR, no, a certificate of product registration. So all other drugs and vaccines in the past that are in the market are getting a CPR. Pero ngayon, dahil hindi pa tapos yung clinical trials, EUA muna sila, no, a special permit. Okay? So hindi pa talaga tapos, but we already know that it is safe and efficacious, and we need it now kasi pandemic, di ba? So next question, do you have to pay for anything? The vaccines are supposed to be for free, no? That's a political and the policy statement of the government. So it's provided to us by different parties, and even if the private sector has bought vaccines, they are supposed to provide it to their employees for free. Next, who are going to be the first, no? Sino ang una sa pila? So, kunwari, for the kids in this call, di ba? Sometimes you ask, no? Pagpapasok ako sa Enchanted Kingdom, sino mauuna? Yung mga bata ba o yung mga matatanda? So, in this case, meron din tayong prioritization. Our goal is to make sure that we maintain or the healthcare system does not collapse, no? What does that mean? We don't want the healthcare system to collapse because when we get sick, dun po tayo pupunta, no? Second is to reduce morbidity and mortality. And this means we don't want more deaths or more people in the ICU. Very simply put, that's the first goal. Second goal na lang natin yung substantially control transmission and minimize disruption of social, economic, and security functions. Then finally, resume to normal. So in view of all of these, we begin talaga with frontline healthcare workers followed by senior citizens, those with sickness or comorbidities, frontline personnel in essential sector including those uniformed personnel, then the indigent or the poorest population. It will then be followed by the following: teachers, social workers, kami, other government workers, other essential workers, etc., etc. No? So, then all remaining Filipino citizens. So, it is also important to take note that within the sectors, importante din to prioritize, di ba? Ano yung ipa-prioritize natin? Yung mga tao na nasa location na mas maraming kaso. So, for example, you are comparing sino unang bibigyan, yung nurse na nasa Metro Manila or nurse na nasa Batanes. No? So, the answer is nurse na nasa Metro Manila. Kasi mas maraming kaso dito. Paano kung within a facility, sino mauuna? Yung mga tumitingin sa pasyente or yung mga nasa, say, cashier, no? Or back-end services, IT ng hospital. Siyempre, yung tumitingin sa pasyente. Then, when and where will I get vaccinated? So it really depends, no? What part of the priority group are you in? If you're a senior citizen, after health workers, kayo na po, no? Next, who is implementing this? It's actually the LGU who's implementing this, no? So the national government just develops the policy, we buy the vaccines, and then it's the local government unit who will implement all of these. But when will the LGUs and the private get to start using what they bought, no? So ang usapan lang natin with our expert, we need to finish the frontline health workers. So from Apari to Holo, from Batanes to Tawi-Tawi, we finish all healthcare workers. Then we finish all senior citizens. All in all, this is around 10 million senior citizens and around 1.8 million healthcare workers. So around 12 million people. Thereafter, we start now with the essential workers, with people who are sick, etc. Next, where will we do the vaccination? The vaccination will be assigned by your LGUs in certain what we call fixed post facilities. No? Hindi po siya pupuntahan kayo sa bahay. And this is because you need to get observed after you get your vaccination. No? You'll be in the vaccination post for at least 15 to 30 minutes after the vaccination. Kailangan kayong ma-observe. Then, we also have an assessment form like this. No? So for every vaccine, iba-ibang klase yung assessment form. And it talks about who does not need to get vaccinated or who cannot be vaccinated. So if you're less than 16 years old, you cannot. If you have allergy to certain chemicals, you also cannot be vaccinated by certain vaccines. If you have severe allergic reaction, di na kayo makahinga after the first dose, you cannot be vaccinated. But if you have allergy lang to food, to egg, or certain medicines, instead of the regular 15 minutes, 30 minutes kang i-observe, no? If you have history of bleeding disorder or umiinom ka ng mga blood thinners, mas maliit yung needle na gagamitin sa'yo kasi baka malakas yung pagdudugo. Also, if you have certain symptoms na parang COVID, dapat you will be referred to a doctor and then reschedule after you fully recover. If you have history of exposure to COVID, reschedule after you finish quarantine. And if you have been previously treated for COVID-19, dapat after 90 days. No? Kung pregnant naman, after first trimester. And if you have any vaccine in the past 2 weeks, you need to reschedule. So ano pa? Ito na, no, yung mga may cancer, HIV, yung important po talaga dito is to get clearance from your attending physician. So special case po kayo. All right. And then yan. All right. Then what should you do before you get vaccinated? obtain accurate information from the right sources, always verify what you read and hear, and declare your complete medical history. So what to do naman during vaccination? Syempre, go to your assigned site and then sign the informed consent. You need to finish 2 doses, that's clear, so for you to get the full effect. And if there is a reported adverse event, the health authorities will make sure that this is investigated. No, we need to make sure if this is really caused by the vaccine or a mere coincidence. Then what should you do after vaccination? It is important for everyone to note that these types of reactions, local reactions, are normal. No, I'm saying it again, it's normal. At least say for example, AstraZeneca vaccines having like swelling or pain on the injection site is common, no, as much as 50%, no. So 1 in every 2 people na binabakunahan talagang mag-experience ng local pain, for example. Then this eventually becomes more general symptoms such as headache, fever, and fatigue. But this is, I'm repeating it, normal reaction to vaccination. It just means that your body is getting to work. I mentioned this already na kanina. So after vaccination, can we go back to not wearing, face mask, face shield, physical distancing? The answer is no, right? Because we need and we know that vaccines are only additional layer of protection. So we still need to do all the other interventions that are outlined here. And kung mahirap yon, intindihin, ito na lang, no? Simple lang ang appeal ko sa inyo. Kung ayaw nyo makagat ng lamok, di ba? Hindi lang naman isang intervention, no? Hindi lang insect repellent yung ginagawa natin. We also wear correct clothing. We use screens. We sleep under the bed net, or we even use katol, di ba? Household insecticides, for example. Ang dami nating ginagawa. So look at the vaccine as only another layer of protection for us. And finally, how do you make sure that vaccines you're getting are real? I wanted to highlight this to everyone that yung vaccines po, no, it's a white fluid. No one can know whether it's real, it's not real, it's spoiled, etc. No? So you need to get your vaccines from the correct source, because if it's from the correct source, the FDA checks the barcode, no, or the lot number of that vaccine. And also, the correct source will make sure that the vaccines are transported in the right conditions. Kasi kapag hindi na siya sa malamig, no, or cold chain, pwede siyang masira and maging toxic sa katawan natin. So for example, some people are saying, oh, may relatives, so they're gonna bring the vaccine from abroad papunta sa Pilipinas. I'm telling you, people have no refrigerator in their backpacks, no, or that refrigeration cannot even be brought into the airplane. So sira na yung vaccines pag dinala siya sa inyo, no. So let's not attempt those situations. All we're pointing out here is it is very, very important for you to know that the vaccines have to be carried in a special temperature specific na carrier. Then finally, we encourage everyone to become champions of correct information. No? Wag tayong mag-spread ng false information, and all of our materials are here for you to download and for you to improve on, redesign, but they are already verified information. So maraming salamat po, and thank you again for this opportunity.
Thank you so much, Dr. Ho, for sharing with us your presentation. And I can see, no, that you're really trying to explain as much as you can to our young viewers. No, we actually have elementary students here, and we appreciate that so much. And although they are elementary students, they are young writers, as you've mentioned. I think we have several questions coming from our participants, as well from our executive director.
Thank you so much, Dr. Doreen. I have just a few questions. The FDA gave Sinovac emergency use authorization, right? But did not advise its use on medical frontliners. This was already in the news. So what was its implication on your program, in the vaccine rollout program? Because definitely it has some effect. Are you able to factor that in?
So the FDA recommended, based on the data that it has obtained, that it is best for use among 18 to 59 years old, and ideally those not at great risks, no? It should be not in those situations na palagi silang nag-handle ng COVID-19 patients. So that part was a recommendation by FDA. However, our NITAG or National Immunization Technical Advisory Group deemed it that some of our healthcare workers who are able to decide for themselves, no, if they are willing to take the vaccine, kasi nga araw-araw naman sila talagang exposed, no, and they should be given the opportunity to say I'm okay to get the vaccine. So how did it affect our rollout? Well, syempre, originally, no, we thought that we could roll it out in a faster pace, di ba? But because we needed to get the consent also of our healthcare workers, whether they want it or not, then nagkaroon po ng option. No, nagkaroon ng option yung mga healthcare workers, and that would mean that it is an extra step in the process rather than just say, eto na, deliver namin, gamitin nyo na siya.
Thank you so much. So dagdag tayo ng option, which is a good thing. Ikaw nga naman. Kami naman, ang thinking namin sa management is something like this. May kasabihan tayo when I teach management, a bird at hand is better than two in the bush. Diba? Kung ano yung meron ka, and in fact, parang si Dr. Fossil, siya yung nagsasabi na the most effective vaccine is the one that you have. Okay, so anyway, nasabi ko lang, baka gusto niyo kung sample ng bakuna kasi I'm willing. Okay. Although, I don't know kung comorbidity yung pagkakaroon ko ng GBS. I had GBS in 2013. All right. So anyway, my second question is something like this. You mentioned it will be LGUs which will be in the forefront of local vaccinations. So, did you actually ask them, or did the DOH require them to submit a plan?
Yes, there's such a thing as micro-planning that's happening. So, I mean, this is not the first time that we have vaccination, no? We have routine vaccination for kids, right? All of the kids need to get vaccinated. And typically, what we have is the DOH and the LGUs are partners. So, the LGUs own the clinics on the ground, apart from the private clinics, and the DOH provides them the vaccine. So, parang ganun din po ngayon, no? So, the LGUs need to draft the plan. Ano yung mga sites nila, yung mga schools ba yung gagawin nilang vaccination center, or all the health centers or all the hospitals in the city are enough, di ba? Galing po yun sa kanila, but we provide them the specification. So, dapat ganito yung mga tao, may isang doktor, may isang nurse, etc., no, in the area. Parang ganun po.
Alright. My last question naman po, syempre alam natin may mga mahihirap na LGU for that matter. And I know government is working hard. I think na-aproba na nga ata yung ating pangungutang para magkaroon ng vaccine. So my question is, kung magre-rely kasi sa IRA or Internal Revenue Allotment yung ating mga mayors, kahit pa sabihin na natin with the Mandanas ruling, they can lumaki yung kanilang share, diba? Because of the Mandanas ruling. Pwede nilang gamitin dyan. Ang concern ko lang, what will happen to those LGUs that cannot afford? So, kasi syempre, lahat naman tayo dapat mapakunahan by matter of siguro right at saka by best practice din. Pero so, ang concern ko dito, mahirap yung municipality mo. Will DOH help you avail of the international financing for this? O kayo na bahala sa kanila kasi alam niyo naman na hindi makakabili ng vaccine?
The vaccines are all going to be provided by the national government. There are richer LGUs who wanted to buy vaccines, so they weren't wala naman nagsa-stop, no, sa kanila, but they need to give it for free to their constituents. And that frees up the money, no, of the national government to buy for the other LGUs. So hindi po naman dapat maiwan yung ibang LGUs dahil they don't have the resources.
Thank you, Dr. Beverly. I think Gab is raising his hand. Gab, do you have a question for Dr.
Yes.
Beverly?
When will the vaccine be distributed to the kids?
The vaccines won't be distributed to the kids because you are still not allowed to receive the vaccines. No, the vaccines have been tested only on adults greater than 16 years old, and so there's no data on whether you will benefit from it yet. No, so you're excused from getting the COVID-19 vaccines, but your parents are not. They should get the vaccines.
Okay, I think we have several questions from Joshua Pakunayan. Would you recommend the vaccine passport for those who are already vaccinated, just like what is currently being proposed in Denmark? Are you familiar with this, Dr. Beverly?
Yes, no, there are many areas that have proposed but not successfully implemented it, di ba? Kasi the reason why you want to have a passport is to have an assurance that that person cannot transmit the disease anymore. But the data now is not as strong enough yet to tell us that if you've been vaccinated, you cannot transmit anymore. Dun sa tatlong outcomes that I've showed you, di ba? Prevent
Process was so
symptomatic
fast. How do we
infection,
know?
prevent symptomatic infection, prevent severe infection, tapos last, prevent transmission. Yung prevent transmission, yung may pinaka weak pa na evidence, no? So, pwedeng nabakunahan ka, maging hindi malala yung COVID sa'yo, pero pwede ka pa rin makahawa, no? Pwede kang maging less symptomatic or asymptomatic, hindi ka lang ma-hospital, pero pwede ka pa rin makahawa. And that's the reason why we still appeal, even if nabakunahan ka na, you still wear your mask, your face shield, do the entire drill.
Okay, thank you, Dr. Beverly. Another question, is there a possibility that the COVID virus could mutate into other variants even if we're already vaccinated?
Absolutely. Parang the variants actually will come in as we get more transmission. So, isipin nyo na lang na kapag sobrang bilis mo tumakbo, pwede kang madapa, no? So, ganun yon, no? The variance is like the more transmission that happens, the more hawaan that occurs, the higher the chances that we get these forms of variants or mutations. Kaya, at the end of the day, yung gusto mo pa rin is low, no, to zero yung transmission mo. So, hindi yan mawawala. Kaya nga sa flu, di ba? Flu vaccine, taon-taon may version ng bakuna. Kasi it accounts for the variants, di ba?
Okay, naintindihan na daw po ni Sir Joshua. Kenneth is raising his hand. Please proceed po with your question.
Hello, good afternoon po. Will the COVID-19 vaccine be mandatory po?
Currently, it's not. And what we are hoping is that people are educated enough and going to be motivated enough to take the vaccines. No? So walang sapilitan, but as we've mentioned in the presentation, we need as many people, as many Filipinos to take the vaccine.
From Mark Dubria, may funds po ba tayo for vaccine? If yes, saan po napunta? Sa news po kasi mostly ang dumadating ay donations from group or other countries. May mga loans din po tayo from World Bank and other banks na sinasabing gagamitin pang bili ng vaccines.
Correct, no? So, isang parte yung may pera tayo pambili ng bakuna, isang parte kung meron bang supply, no, na ibibigay sa atin. Diba? Parang ano lang yan, recently gusto natin bumili ng karne pero walang karne, diba? Ganun siya, no? Ang problema natin with the vaccines is 80% of global supply is already nabili na siya ng high-income countries. And so, we have placed the orders, but really the orders will come in late second quarter or third quarter. So, yun po, meron na order na po, pero late lang po talaga dadating yung supplies po because of global supply issue.
If available from Immaculate Conception Academy, Blychua, also a student, if I say a private hospital like St. Luke's perhaps buys the vaccine, can we regular people get it for free from the hospital or do we need to pay them? Private hospital to, no, Blythe?
You will have to get it from your local governments, no? So the way this goes is parang isipin mo you're getting free vitamins or wherever, di ba, from your local government. So the local government, say of Quezon City or San Juan, will decide, no, will I just use my clinics, no, the health centers in San Juan, for example, because you're from ICA, or will I get certain facilities? Will I ask Cardinal Santos, for example, to become also a site, no, where people can get vaccinated? But because of the nature of the vaccine, they're getting a special permit called an EUA. It cannot be sold. No, so you shouldn't be buying it. If you're eligible to get it, it's either the local government gives it to you or your employer, because they wanted to buy vaccines for their employees, they will give it to you for free. But people shouldn't actually shell out money for it.
I think that answers yung question ng teachers natin kung libre po ba ang vaccine, no? Na-mention na po ni Dr. Beverly na we should be getting it free from our LGUs, okay? A question from Ken. If everyone is vaccinated, we are still on an ongoing battle against COVID-19 by following minimum health protocols. When will we go back to the pre-pandemic status? Like when we can go with our kids and can have super spreading events like concerts.
So, di ba, parang what we mentioned kanina is that, so first of all, I wanted to tell you that there are some early evidence, no, from CDC that's saying na, okay, perhaps when two people who both get vaccinated, when they see each other, they could probably not wear masks, di ba? May ganun na pong evidence, no? But the question is, how will you know if, kunwari, gradual yung pagbabakuna natin, how will you know na yung kasama mo, no, nabakunahan na siya or hindi, di ba? So basically, what we want to happen is that as soon as we can, by this year, we vaccinate as many people in particular geographic areas na mataas yung transmission, di ba? And when we do that, no, kung mas marami na sa atin na bakunahan, sure tayo, mga katapat natin, kausap natin, ka-commute natin, then perhaps that's an option, di ba? Pero as long as hindi mo alam yung katabi mo na bakunahan ba or hindi, it will be very difficult. Kaya nga, this responsibility to convince everyone around us to get themselves vaccinated cannot just be a responsibility of the government. If we want to return to normal, we have to make sure all of our families, friends, co-workers actually do this. Now, if most of us do get vaccinated already, and by that time, by end of the year, we likely would have data, no, on gaano ba katagal yung protection ng bakuna. Dapat ba para siyang flu vaccine na every year? Or baka naman pwedeng every 2 years siya, then slowly, no, our routines can go back to normal. Again, if most of us are vaccinated, yung diagram po na pinakita ko sa inyo kanina, magiging color orange na tayo lahat. The kids are the blue ones, di ba? Hindi sila yung pwede mabakunahan. Pero if all of us are protected, then even if lumabas yung mga bata, hindi na sila mahahawa kasi napoprotektahan natin sila.
Thank you again, Dr. Bev. From our teacher, Mr. John Kevin Gambal, do you know if there is already a plan or schedule of vaccination for DepEd teachers or employees?
Okay, so if you're a DepEd teacher or employee who's a member of the health team of DepEd, di ba? So part kayo nung healthcare worker group. If you're from DepEd teacher who's senior citizen, you're part of the second, no? So after matapos ng mga healthcare, kayo na po, di ba? Then, kung DepEd teacher ka pero hindi ka healthcare worker, hindi ka rin senior, may comorbidity ka, nagda-dialysis ka, may high blood ka, ganyan, you're on the third one, di ba? Everything else, kung swerte ka, wala kang ibang sakit, doon na po tayo sabay-sabay sa group B, no? Ibig sabihin, dapat matapos pa yung mga frontline economic workers, no? Yung mga nag-work sa palengke, etc., yung indigent, bago po tayo. Kasi priority group B pa tayo.
Okay, I think we can have our last question for Dr. Beverly. The rest, I think, will be in the link that Dr. Beverly sent us, no? Yung usual FAQs, frequently asked questions natin para sa DOH. So I will select one last question here. Okay, so how do you respond to Filipinos' resiliency during this pandemic? Kasi daw, the cases are growing fast due to COVID variant from other countries.
How do we respond? Sorry, what's the question?
How do you respond to Filipinos' resiliency during this pandemic? From Tene Francia.
I think yeah, from the DOH side, we would like to say thank you actually to all the Filipinos who actually did their part. The pandemic was not easy even for at least me, no, for someone who's been in health sciences for much of my life. Hindi po siya madali, no, for many of us grappling with something that no books had taught us about, di ba? Parang it was a new virus, etc. So I think everyone's ability to I guess adapt with the new rules, with the new lifestyle, etc., and really being very patient about the entire situation. I think that's something that we should be proud of, and kami from the DOH side, we're really grateful for, di ba? Yun.
Do you have any closing message to our young journalists and school publication advisors?
So thank you, first of all, for this opportunity to allow us to speak to you. I do hope that you learned a lot from the session this afternoon, but I also encourage you to continue following the different platforms of the DOH, because the information now changes, no, week to week. And this is a very good practice for, I guess, young journalists like you who want to write about it. Ako personally, I was trained as a doctor, but I came into the pandemic suddenly doing work in public communication. No? So parang ako rin kayo, natututo lang din ako, no, throughout the pandemic. I guess what we learned is that the journalists, the media are really one of our strongest partners in getting to our messages to the public, diba? No one has the monopoly of information now, especially with so many social media channels, etc. No? So all of you are influencers in your own right, and I hope you can, as young as you are now, you can use your voice towards very positive changes in the society. And together, kung mas marami naman sa atin nagsasabi ng correct news, edi matatalo natin yung mga perpetrators of fake news, di ba? Yun yung mga nakakagulo sa mga desisyon ng ibang tao. So yun lang. Good luck to everyone here. Hoping that one day we get to work with you closely, and God bless to all of you. Thank you.
Thank you so much again, Dr. Ho. Just to show a little appreciation po, no, we would like to present to you this certificate of recognition. We would like to award this certificate of recognition to Director Beverly Lorraine Siho for her invaluable contribution as guest speaker on the topic COVID-19 vaccination rollout game plan during the third World Cup Forum, DOH meets Campus Press, given this 13th March 2021 via VTC, signed by Eugenio Sonny Calapi, TDD, ENP, QMP, Executive Director of EdCaliber International. Thank you again. Thank you so much, Dr. Ho. I know you're very busy Actually, sabi nga po sa amin, hanggang 3 lang po talaga si Director Ho kasi madami po siyang ina-attendan. Marami po siyang kailangang asikasuhin. And lastly, baka pwedeng paki-open po ng camera nyo so we can have picture taking, photo op. Let's take this opportunity. 1, 2, 3, smile. Next slide, next page. Okay, bukas po tayong cam. Okay, so I think I've captured every page of the Zoom. Thank you so much, Dr. Beverly, and we hope that you keep safe. We hope our students and teachers here today are also safe practicing the social distancing and other reminders from DOH. We will be sending the links, the PowerPoint, the FAQs page from DOH as well to our participants' email addresses. So thank you again, Dr. Ho. To our participants, please answer the evaluation form so we can give you your e-certificates, okay? And the PowerPoint presentation, okay? We will be sending it to your email. Just give us a little time to provide you and send them, okay? So, can you see it here? It's on the chat
Thank you,
box.
everyone. Thank you, Dr. Ho.
Huwag po sana kayong magsawa na every weekend nagkakaroon tayo nito. Just a short announcement. Aside from the evaluation forms, don't forget to register to our next, to our 18th World Cup 6 Journalism Masterclass. So that's bit.ly/18th World Cup. We have moved it because we hear our teachers na madaming ginagawa. We hear the parents nagpo-move actually sila to April 17 to 18, 24 to 27, and May 8 to 9, and 15 to 16. So don't forget to register and we wish to see you there. The registration for the 18th World Cup 6 Journalism Masterclass is also posted in our chat box. Yeah, no, I'm posting here sa chat box natin. Our forum is actually finished, but I'm leaving it here para so that you can copy. You can take a picture of our links. Yes, kanina din, no? Dr. Beverly posted the link for the naka-off naman ako. For the FAQs page of DOH.
Yung hindi nakapanood, damo,
pwedeng manood sa YouTube. Hindi na kompleto